Understanding the mental health needs of veterans and their families is a vital aspect of effective care. This episode complements therapy training's mental health specific to veterans and families training course. We'll summarize key points, discuss strategies for supporting veterans' mental health, and address common misconceptions in this field. By exploring these topics, you'll gain insights into working effectively with military-affiliated clients and their families, enhancing your ability to provide informed and compassionate support. Let's kick things off with the fundamental challenges that veterans and their families face. When we think about veterans, we often envision soldiers returning home from combat, but the reality is much more complex. Many veterans grapple with mental health challenges, including post-traumatic stress disorder, or PTSD, depression, anxiety, and substance use disorders. These issues don't just affect the veterans themselves, they ripple out to their families, affecting spouses, children, and even extended family members. One of the course objectives is to help you understand the mental health challenges faced by veterans and their families. Research indicates that around 20% of veterans who served in Iraq and Afghanistan experience PTSD, and other studies show that the number can be even higher among veterans of previous conflicts. So, why is this important for you as a mental health professional? Understanding these statistics can help you to recognize the signs and symptoms more readily in your practice. Knowing the common challenges can empower you to provide better care and support. Now let's transition into effective screening techniques. Screening is crucial when working with veterans. It's not just about identifying PTSD. It's also about recognizing related issues like addiction and suicide risk. In fact, veterans are at a higher risk for suicide compared to the general population. This underscores the importance of using evidence-based screening tools to assess their mental health needs. You might wonder, what are some effective screening techniques? Tools like the PTSD checklist for DSM-5 or PCL-5 can be particularly helpful. This self-report questionnaire allows you to gauge the severity of PTSD symptoms and is widely used in clinical settings. It's important to create a safe environment when administering these assessments. Building trust and rapport is essential. You can start by explaining the purpose of the screening in a straightforward manner. As we delve into the course content, let's talk about evidence-based interventions and treatment approaches tailored specifically for veterans and their families. Cognitive behavioral therapy, or CBT, is one of the most widely used approaches. It helps individuals identify and change negative thought patterns that contribute to their emotional distress. However, it's not a one-size-fits-all solution. We also explored the importance of family and marital counseling in supporting veterans' mental health. When a veteran transitions back to civilian life, the entire family experiences a shift. Family counseling can help improve communication, resolve conflicts, and rebuild relationships that may have been strained due to the challenges of military life. It's essential to involve family members in the treatment process. This not only supports the veteran, but also strengthens the family unit as a whole. Another key objective of the course is developing cultural competence and sensitivity when working with military-affiliated clients. Military culture is unique and often comes with its own language, norms, and values. Understanding this culture is key in establishing rapport and trust. For instance, many veterans may have a strong sense of pride and may be reluctant to seek help for fear of being perceived as weak. Acknowledging their service and showing appreciation for their sacrifices can go a long way in building that connection. Now, let's shift gears and address some common misconceptions about veterans and their mental health. One major myth is that all veterans suffer from PTSD. While it's true that many do face this challenge, not all veterans experience PTSD or need therapy for it. Many veterans transition successfully back to civilian life and lead fulfilling lives. This misconception can lead to overgeneralization and unintended stigmatization. Another misconception is that seeking help is a sign of weakness. This is especially relevant in military culture, where individuals are often taught to be resilient and self-reliant. As mental health professionals, we must work to dispel this notion. It's essential to communicate that seeking help is a strength, not a weakness. Encouraging veterans to view therapy as a tool for growth rather than a last resort can help reduce the stigma around mental health care. So, how do we address these misconceptions? Education is key. Share information with your clients that highlights the diversity of experiences among veterans. Use positive language to frame therapy as a proactive step toward achieving personal goals. Normalize the experience of seeking help by discussing it openly in sessions. As we wrap up, let's reflect on some thought-provoking insights. Mental health care for veterans and their families is not just about treating disorders, it's about fostering resilience and promoting holistic well-being. It's about creating a supportive environment where veterans feel valued and understood. To all the mental health professionals listening today, remember that you have the power to make a difference in the lives of veterans and their families. Every interaction, every conversation, and every session counts. If you haven't taken the course yet, I highly encourage you to check out therapy trainings at therapytrainings.com. They offer a wealth of resources that can enhance your skills and improve your practice. Thank you for joining me today. I hope this episode has provided valuable insights into the unique challenges faced by veterans and their families. Remember, understanding, compassion, and effective communication can transform the therapeutic relationship and ultimately lead to better outcomes for those we serve. Until next time, take care and keep learning.